Are we on? All right. Hey guys, welcome everybody. Happy Wednesday. Beautiful day.
It's gorgeous. It's gorgeous.
This is what I've been waiting.
I've got no windows in my office, and it's a gorgeous day. I'm close right now. I'm going to pay the higher rent to get over here.
There you go. There you go. Well, anyway, guys, welcome. So grateful you're here with us, and we got a couple things to talk about. The main thing is we want to talk about this HIP plan. It's here.
It's here.
Right?
It's here in most states. But we got to get some information out there. I do think that I think a lot of more states are going to be falling in by this time next week.
Okay.
But anyway, we just need to start disseminating some information to everybody. So
we're going to cover that.
Yep.
In as much depth as you can today. And then we got one other thing. We thought we kind of threw this at Jason, and we'll just tell you guys here, we'll give you a heads up. We're going to do a special webinar. Most likely it's going to be this coming Monday. We'll give you a heads up. We'll send you out a notice about it. But we've just been made aware of an electronic scope of appointment that we're going to have access to across the board for any MA carrier, right?
Correct, but it pairs very well with the requirements that Lasso has got.
Right.
If we do one either by paper or if we do one if we send it by fax or mail, the scope has to go with it.
Okay.
And so, but in some cases, it's a remote scenario where you're doing one over the telephone.
Right.
I've actually done one like this.
Okay.
Where I've actually had the client pull up the scope of appointment,
Yeah.
fill it out, sign it, mail it to me.
Yeah.
And then when I get it in the mail, then I've made the phone call.
Okay.
And did it
okay. Anyway, but this is coming on Monday. We're going to whip one up and have it for you because we think it might be a really, really useful tool for everyone. And we want to make a bigger deal about it than just the folks that we got on here today. Not that you're not a big deal, because you guys are, but we want to make sure everybody knows about that and they have time to get set up to see it. So that'll be coming on Monday. So let's go, Steve. Let's go on the HIP plan here.
Plus, we think that e-scope is going to be an easy way to manage. I've been through the tutorial, and if I can handle it, I promise you our client, our
all right.
Can
so more to come on that on Monday.
Okay. So if we could click on to the next piece. This is, I was torn between designing something or just going straight to our website or the Lasso Healthcare website, folks. And so what we decided to do was just make this specifically right off the website. So if we go to other products in the upper right-hand corner, that's a brand new tab this year, and it is exclusively for the HIP product this year. So if you need any information about the HIP product itself, other products is a brand new tab this year that is specifically designed for this particular product. We can go here and we can see a lot about how it works. We can do, there's a paper application that we can download and print. We're going to be able to do electronic enrollments as of Tuesday. And by far and away, I would highly recommend learning how to do an electronic enrollment, both for the MSA and the HIP plan. It is going to keep the process as speeded up as we can possibly get it, because there is some underwriting on this hospital indemnity plan. In fact, we'll probably go through the application and go through a few of these questions. Point being is that we know the MSA can happen as long as the people can answer the question about end-stage renal disease. We don't necessarily know, based on some health questions, if they're going to qualify for the hospital indemnity plan. Now, I've been working with Lasso and some of the people on what we think is going to be the turnaround time. Where this becomes very important is, I will tell you that if we push off a Lasso MSA appointment, say to December 1st, and in that conversation, that person decides to want to try that hospital indemnity plan, we're probably pushing the envelope. If it's a decision that they have to have that to be good,
to go with the Lasso, they need the HIP.
Right. I don't know that we can have that information back by December 7th. So my point is, if in your mind's eye, get your MSA appointments set up and done on the people that you know that could be a potential. I mean, I think they're all going to be potential, but just get them done. Just understand that it's going to be out of our hands when we get closer to the end of AEP. and it's a decision that's going to be based on that hip, it's just going to be pushing the
I
envelope.
see. Because
Okay.
the point being that they might not have a decision on the underwritten on the hip
Yes,
till after the 7th.
exactly.
And if the guy says, if I'm going to buy this MSA, I got to have that hip.
Yep.
You better make sure you give yourself enough time for the hip to get through underwriting.
That's what I'm trying to convey.
That's how I said it.
Okay, but
All right. Okay. I got it.
You're better than I am. on that.
Oh my God.
And I'm just going to read from this. Hospital stays can be expensive and can quickly extend beyond your budget. So many times, even as I'm trying to sell this product, is the first question I ask the beneficiary is, can you handle it? How would you handle it? In the event that you have a catastrophic loss, where's this money going to come from? Is it going to come out of a bank account? Do I have to liquidate something, or
Right.
where's this? Do I have
What's
another
your plan?
source? What's your plan? And put a plan together. A hospital indemnity plan of any kind. It can be written with Medico. It could be written with Aetna. But those typically pay a per day
Right.
figure
Right.
for so many days.
Right.
And while that is useful, the Lasso product is specifically designed to pay a lump sum amount after one hospital stay.
Boom.
That's exactly correct. Combined with the Lasso Healthcare MSA, our HIP product provides additional financial coverage of the MSA members' responsibility amount. As we all know, there are 3 regions where we've got a $7,400, $8,400, and $9,400 responsibility. With the deposit, that leaves a $4,160 responsibility in Region 1, $5,160 in Region 2, $6,160 in Region 3. There are 3 HIP plans, and this is a good combination. If some of you have been on our webinars in the past, we put together a grid where if people had some money, but the health was questionable, or if they had a little bit of money and their health was fabulous,
Yeah.
This talks about the very same philosophy. This is the only thing that it doesn't make sense on is if a person is chronically got problems,
Right.
and if they're challenged with money.
Right.
There are just other vehicles out there that the people
Not the
can
best
get.
fit.
That's exactly correct. MSA members are financially responsible for all costs until reaching their deductible amount. And so the thought being from Lasso's perspective is that in the event that someone wants to insure that deductible, they can take that deposit, that steady deposit of $3,240, and based on the region that they're in, they can purchase a HIP plan that will consume well over 95% of the remaining balance.
Almost get them all the way home.
Exactly correct. Leaving less than a $200 responsibility in the event that all things worked out properly from that perspective. So there's a $4,000 HIP, a $5,000 HIP, and a $6,000 HIP. Some of the key features of the HIP plan is it is going to be a cash benefit straight to the beneficiary. This money is governed differently than the MSA money. As we all know, that MSA money is earmarked for qualified medical expenses ruled by the IRS for Part A and Part B. Not so for this $4,000, $5,000, or $6,000 hospital indemnity plan. Ideally, the money would be put into a bank and utilized to offset the deductible up until the, but they're not governed to do that.
Right.
If they need to pay a bill, it's a light bill.
Cash they can use.
It's cash that they can use. It's an indemnity plan.
Got it.
It's a cash benefit to the beneficiary. You basically decide how to use the benefit payment. There is no deductible to meet, and there are no network of providers that this applies to. In the event that you get into a Medicare approved facility, a Medicare approved stay overnight for a 24-hour period, this policy will pay out either of the $4,000, $5,000, or the $6,000 indemnity benefit that you've got coming your direction.
So one night inpatient stay, you get paid.
It's exactly correct.
4,000, 5,000, or 6,000. Okay, got it.
There's also an observation benefit as well, and we'll get into that. There's a grid going on.
Okay.
This is the HIP. Is the HIP the right supplement to have? This grid, I don't want to get into it. It looks a little complicated. I would ask you to go through it yourselves. All you guys can, it's right there on the website. Go to the other documents and get to this and try to understand it. But if you were with us on our quadrant where we decided if you had, if you didn't have any chronic conditions and you're in good health, no, you don't need to mess with this. If you've got wherewithal and you've got your health, a HIP plan may not be the right answer. If you've got a questionable health and a little bit of money, it just makes sense in a lot of different of those quadrants. So this is Lasso's version of that same quadrant. Just come to know it. They're talking about chronic illnesses at the top when you see 0 plus low, 0 plus high, 1 or more chronic conditions plus low, 1 or more chronic conditions plus high. And basically what they're talking about is just what is the risk of getting inside that hospital? Okay. So it just plays out in a lot of different ways. Okay. Here are the 3 unique benefit options. We got the Lasso plus 4, the Lasso plus 5, and the Lasso plus 6. Makes sense that we've got an inpatient benefit of $4,000, $5,000, and $6,000. The observation benefit, if there is a Medicare approved observation that has been ordered, then we've got a minor benefit. In the Lasso plus 4, there will be $1,000 for that stay.
So give me an example. What would an observation benefit be? Do you know?
I think an observation is a different. I don't know. I don't know how to put it defined.
Because I know, like, I'm thinking like on inpatient, I know in the med sup world, guys that are listening out there, there's a thing that's been going on the last couple of years that you could be in the hospital for 3 or 4 days, 5 days, and sometimes they won't consider it inpatient.
Correct. It's observation.
And it's observation. And so if they get transferred on to a skilled facility, you can't get the Medicare benefit because they don't count it as 3 days, it requires 3 days. So it must be the same rules as that,
set of rules
that if you're there overnight, but it's not considered inpatient, you're going to get $1,000 and not $4,000.
Exactly correct.
Okay.
Exactly correct.
That makes sense.
And you can see that the Lasso plus 5, that observation benefit is $250 more, $1,250. And in the Lasso plus 6, it's $1,500.
So I'm looking on here, Steve. So like, let's say they buy the 4,000 one. The most they can collect in that year, no matter how many stays they have, is $4,000.
That's it.
Because that's all they're going to get charged on the Lasso. Is
Exactly.
the one deductible. Makes sense. And then over the policy lifetime, they can collect on it twice.
That's exactly correct. And the reason why it was limited at 2 times, if somebody needs that
every year, they're really not in the right plan.
Years, they're probably not in the right plan.
That makes sense.
We at least want to have somebody to have another conversation
that makes total sense.
About the viability of that product.
Okay.
Now, you can have multiple observation stays in 1 calendar year. For example, the policy limit is $4,000. If I have 2 observation benefits, I've been given $2,000, and then I have an inpatient stay, I'm only going to get $2,000.
I get it.
There is a $4,000 calendar year max payout period. You got it.
Got it.
So it goes clean across that we've got right there. Okay, we've got some questions, and these are we're gonna get into that. John, can you read that?
I can, but it don't look like a question. It's from Betty. It just says 25% of the inpatient benefit. I guess that's just a comment that the observation is 20.
It could be. It could be. Yep, so, it is. It is.
Okay.
It is. It is.
All right.
The premiums at the bottom, when we see the monthly premium of 56 to 111, the issue ages for this policy are from 65 to 75. Okay, so aging in, I can expect to pay $56 a month for this premium. Age 74 to 75, I'm looking at 111 for the 4, and you can figure it out for the other 2. We'll take you to a spot where these premiums are at based on the age, and they are age banded from the standpoint that as I age, that premium does go up. Okay. Basically, the benefit payment can be used to pay out-of-pocket medical expenses such as hospital or provider bills, recovery expenses, or even day-to-day living expenses. The light bill is what we were talking about just a little bit ago. You decide how best to spend the payment on the indemnity plan.
Okay.
Not the same set of rules as our MSA money. We receive care for a covered hospital stay we submit a completed claim form and documentation. That claim form will be in the documents section of our Lasso Healthcare that we can provide to our beneficiaries, or they can go there and download one themselves. And then again, once the thing gets paid out, you decide how to use that benefit payment.
Okay.
Policy remains in force as long as you pay premiums. There is only one option, and that's a monthly bank draft is on the payment side of the equation.
That's fine.
Yep. Okay. The dark states is where it's available right now. I think I counted 12 states, including the District of Columbia, where it's at. I know Ohio was just recently added a couple of days ago. I fully anticipate, I'm hearing all kinds of good stuff that this is going to be available in the next week to 10 days in the rest of these states. I know that there was a kind of a list of 6 that I think are going to fall by this Friday. So as they come, you'll get notified.
Indiana and Kentucky are hitting, do you know?
They were up next.
Are they?
In
Okay.
fact, I think.
So it's good in Illinois right now, and Indiana's any minute.
Yes, I think what happened was I think that there needed to be a signature sent back and forth.
Okay.
And
all right.
so once that got done, I believe Indiana is going to be involved in the whole thing. So
okay.
That's just a good map to have. Okay, you can apply online after October 15th, or you can download below to print an app and mail it for paper. So let's click on Illinois and let's apply by mail. This is what the application looks like. It'll look like this whenever it's electronic, or this is exactly what it looks like for paper. So if you download this, you can see that we've got all the incidental information, first name, middle name, last name, all that. Beneficiary information. Optional, of course, but in the event that something happens, there has to be some way to know who to pay the money to. Requested effective date, anything sold during AEP is obviously going to be January 1st. The product that we pick, the Lasso +4, the Lasso +5, the Lasso +6. And then we get into the states. This is the bank draft piece of it right here. It's always going to be drafted on the 10th day of the month. There is no other options. It's just a simple, this is the way it is type of deal. Asks a few other health insurance questions right here. You can go to the website, peruse this. You got any questions, get back to me about any of the health questions.
Let's look at these really quick.
Sure.
Just, I want to look at the health questions, Jason.
Sure.
Back. Keep going.
ABC.
No, other way.
Look at A.
No, I'm going to look at the health questions. Underwriting.
Okay.
Are you currently pregnant? Okay. Are you currently confined to a hospital or nursing home? It's a piece of cake. Do you have a condition for which a medical procedure, including but not limited to surgery, has been planned, or have you been advised by a professional that you should schedule a procedure in the next 12 months? It's a deal breaker. In the past 12 months, have you received wheelchair oxygen, confined to a nursing home or hospital? Okay. Number 5, in the last 12 months, have you been treated for COPD, chronic liver, hepatitis C, neuromuscular, MS, memory disorder? Okay, great. Number 6, the past 12 months, have you been treated for diabetes that requires use of 50 or more units of insulin daily? Involve complications including peripheral neuropathy. Okay, then complications of diabetes. In the last 12 months, have you been treated for heart attack, stroke, TIA? All right, 1 year for cancer. I'm sorry, guys. Obviously, I'm looking at this for the first time too. Steve's looked at it, but I'm looking at it probably like a lot of you guys are. Is there any like really tough? Okay, I'm sorry, I'm reading them. Well, really, it looks like to me, Steve, like this is a really, really generous MedSup app. I mean, these questions are a lot more generous than a typical MedSup, but there are definitely some knockout questions that's going to knock some people out too. That aren't going to be able to get.
Without a doubt.
That's just it. I mean, it's not like it's open enrollment on this HIP plan, but it is going to be simplified, easy issue. Like a very, very easy. We don't have a MedSup this easy, just for me glancing at it that first glance. But so it's an underwritten product.
It's exactly what it is.
Yeah.
And all those little checkoff boxes need to be checked off. Agents, they're the signature pages. And then as we scroll towards the bottom here, we're going to get the fraud notices, but we're going to get to the spot right here where this is the applications, the cost,
Okay.
between 64 and 75. Now, this is for all other states with the exception of Arkansas so far.
Okay.
Arkansas is the only one that's a little bit on the
yeah.
high side, and for
Okay.
whatever reason, there's just a few pennies difference, but it's a different price schedule. For the first 12 states, age and at the policy issue is
Okay.
exactly the cost right there. And so,
Okay. All right.
okay.
Got a couple questions here. Here's one from Rebecca. Is there an incentive for selling this? They pay commission on this, Steve?
Yeah, they do, by golly.
Oh, you're going to probably get to that, aren't you?
Let's talk about it right now. That's a great question because it is a little bit different, and it's different for a strategic reason.
Yeah.
This HIP plan is specifically designed for the Lasso MSA, but we cannot discriminate and keep anybody else from wanting to apply for this. In other
Okay.
words, I could buy an Aetna MAPD product and still buy this Lasso Hospital Indemnity plan,
Okay.
and there's nothing we can do. Other than this, the commission's paid on all other hospital indemnity plans, Aetna's and GTL and Medico. It's pretty more, it's a lot more substantial. The initial commission paid at the street level agent is 10%. And so that's going to deflect a lot of people that aren't going to sell this in conjunction with an MSA. But here's the beautiful part of this, when we sell the MSA product with the hospital indemnity plan, besides the 10% commission, Lasso is going to pay a $200 bonus for keeping that in conjunction with the MSA. Therefore, that obviously is going to make the juice coming back to the.
So let me give it back to you, make sure I got it. So the comp on it street is 10%, and there's a $200 bonus in addition to that, as long as there's a Lasso MSA in place.
Correct.
Because really, Lasso wants this plan to be sold only when there's a Lasso MSA in place, and they can't discriminate. But that's the way they do it to catch it. That makes sense. Okay.
Now, if you sold a Lasso product last year, and your client is going to stay with this, and you put a HIP plan with it, that is still eligible for the $200 bonus as well.
All right.
So
that makes sense. Okay, another question, and this is a dandy. And if this policy is only for ages 65 to 75, why is there a pregnancy question?
Russell, if I had known, I had him on the phone about an hour ago.
Every now and then you get these people that move over here from the Himalayas, and they've been known to have
children age 65.
Children, so I guess you got to cover all your bases. I don't know, Russell. That's a good question.
When first time I read it, I couldn't believe it either.
No good answer for that one. Let's go on.
Russell.
Yeah.
There's not. This is the first hurdle we're going to jump though.
All right.
Okay.
Okay, here we go. If one had a heart attack 15 months ago, are they considered still being treated and thus a rule out? I'll take a stab at this, but we need to find out because, guys, this is our first flush at this also. But I would say they're going to look at the episode that if you had a heart attack 15 months ago and the time frame was 12 months, I believe, that's going to be okay if they're on like a maintenance medication for it now. That's what I would assume. And they would say, well, you had a heart attack 15 months ago. Now you're on a medication for it. Because you're on a medication, that's considered treatment. I would guess it's going to go by the episode or the occurrence date, but let's clarify that. Maybe we hit Monday, we'll
readdress it.
One other question here from JD, renewals. Yes.
Pays 10%.
It's level.
It's level.
So it's that 10 for life.
David Langley has a hand up. I don't know if he wants to talk.
Talking permitted.
Is he there?
No.
Okay. All right, we'll keep moving. What else we have, buddy?
Well, other than I want to reiterate again that scope of appointment is going to be huge. It is simple. I'm telling you that if I can navigate my way through it,
Okay.
John, people are going to do it. We'll be able to tell people additionally, if you want to join in on Monday, I promise you, we're probably going to have a half a dozen more states that are going to be on this list.
Okay, we'll kind of double dip.
If you're in a state that it is not, you will know probably first. You'll be getting an email from Lasso, maybe even before I find out.
Okay.
For example, I know that Delaware doesn't have it, but if somebody is in Delaware, I know they ship that right
Okay.
out. And so anyway.
Okay.
And David, did you have a question?
Yes, can you hear me?
Okay.
Okay, cool. A technical question here. If somebody had AFib, would that be treated as a pre-existing condition and they would have to get past the 6 months mark before payment would be received for an admission related to the AFib?
You know, on some of these technical underwriting questions, I think we're going to have to, I'll take a stab at it, but I feel to really be sure, we need to take it to the underwriter with Lasso and say, how's this going to be handled? But I'm going to relate it to a med sup because like I said, when I look at the health questions, this looks like a really, really generous, liberal med sup underwriting. And on AFib, I know most carriers that we work with, they all look at the episode. So, you know, you might have AFib, you might have it for 10 or 15 years. What companies are looking for, did you just get diagnosed with it like 6 months ago? You know, so if the time frame was a year or maybe it was 2 years, I don't know what it was, they're looking for, have you been diagnosed with it longer than that time frame, maybe 2 years ago, and it's been stable. You're on medication for it, of course, but it's been stable. You haven't had any other episodes. You haven't had to go back to the hospital for it, which would be considered a new kind of a startup again on the time frame. That's what I would guess it is, David. But I don't, you know, nobody's written any of these yet. I don't have any experience, but we'll kind of drill down on it and get a little bit. When we come back on Monday on this eScope thing, which is Lasso, but it's also for any other MA, we'll try to drill down on that a little bit more.
Yeah, I'm going to ask Lasso if they intend on having like an 800 number, David, that if you're sitting in front of a client and it's the 3rd week of November and there's a question about what's going on, that you can't pick up an 800 number and give a phone call to get
Do a pre-qualify.
Do a pre-qualifier of some kind.
I'm sure it is.
Because again, we start getting into the blood and guts about these different claims, and it could be a little bit dicey.
But we'll know more, you know, as we get experience in it. But some of these things, let us drill down on them, and then we'll kind of hit it high on Monday. Okay, got another question here from Lucas. From Lasso MSA account funds, can we use them to pay to buy this product? I know the answer to that. No,
go for it.
You can't. The only thing you can use MSA premium or that deposit for is to pay for long-term care, short-term care, individual. Yeah. So no, and then online application, we touched on that, James. Yes. Yeah.
It will be available on the 15th. It's not up there right now, but if you take a look at that pink bar where we just got onto this page, it's right above there. It says we can apply online after October 15th, James. This is the place to go to. You'll be able to online upload it and go from there.
Okay, and then JD has one. I guess it's JD. Does someone with a condition on stabilized meds count as having treatment? Again, we're kind of touched on that. I would say no. I'm going to say that would not be considered a deal breaker. They're looking for episodes or first occurrence kind of time frame. So, and I'm sure there's going to be an underwriting guide in this.
I would certainly hope so.
So let us on the underwriting questions, which that's what I'm always interested in too. Let us come back to those.
Betty's got a question right there.
Okay, you answer that.
The answer is yes. The answer is yes. If I buy the MSA today, Betty asked the question of, can I buy the HIP plan later? The answer is yes. You simply got to go through underwriting and the dates. Again, the bank draft, and it'll be age banded, and away you go.
Okay, one other question here from David. Any payout for an outpatient stay at an ambulatory care center?
At first, my answer is no. It was going to be inpatient hospital stay, and it's also going to be an inpatient
So
observation stay.
an observation I know has to be inpatient.
Yeah, and
So I would say outpatient.
that's where it
no.
was designed at. So
All right, guys, I hope that helped. You think it
I
helped?
do. I hope to help as well, because again, this is not unusual on a brand new product to have the kind of questions. I couldn't think of all the questions to get with the people at Lasso, but the great group of questions so far. And
We'll come back a little bit more on underwriting on Monday, along with that e-scope, and we'll make sure and get everybody an invite and know when we're going to do it and all that.
yep,
Okay.
yep. So
All right, guys. Anything else, buddy?
been really good.
Okay.
It's been really good. Appreciate
All right.
everybody's
Thanks,
efforts.
guys.
So
Have a great Wednesday.